If we are considering the possibility of synovial sepsis, then it is vitally important to perform synovial fluid analysis, looking at the total white blood cell count, the differential white blood cell count, and the total protein concentration. If you are considering infection anywhere, then measurement of serum fibrinogen and amyloid A concentrations may be of value. If you think that there may be a primary muscle injury or exertional rhabdomyolysis, measurement of serum creatine kinase and aspartate-aminotransferase concentrations may be of value, particularly for confirming the presence of exertional rhabdomyolysis. Bear in mind that normal serum muscle enzyme concentrations may be seen in a horse with a focal muscle tear. And just occasionally, other laboratory investigations, for example, the measurement of serum calcium concentration, may be of benefit with a strange, unexplained stiffness or lameness. If you need to refer the horse for further investigation, you first have to establish that the horse is fit to travel. You need to establish what transport is available, how can the horse be loaded safely, and in which direction should it face. Consider, should the limb be supported, and if so, how? Should drugs be administered to provide analgesia and/or antimicrobial action? Is fluid therapy required? And make sure that you comprehensively provide notes of the history and your observations to the receiving veterinarian. You may be in the scenario when you have to consider humane destruction, but this should only be performed if you are confident of the diagnosis and prognosis. If you're inexperienced, seek advice. With smartphones and video footage, it is easy to get expert advice, and it is well worth developing a good relationship with an expert. Bear in mind there may be insurance implications with the performance of humane destruction. We have, however, to take a pragmatic approach. If there is obvious instability of a pastern reflecting a fracture associated with palpable crepitus, and the horse is out on a track a mile from the road, inaccessible to vehicles, it may not be necessary to try to move the horse in order to acquire radiographs in order to confirm the diagnosis. Equally, if the horse sustains a complete tibial fracture during jumping after a known previous traumatic injury, the diagnosis is usually self-evident and the prognosis is poor. So my take-home messages are: assume control, but forewarn the client that sometimes the diagnosis is not immediately obvious. Pay attention to the history, perform a comprehensive clinical assessment, revising your anatomy on the way, and repeat this if necessary. Seek specialist advice if you are out of your depth, and refer if necessary for appropriate investigation and treatment.